I now request Dr. Sanjay Bhavnani sir to take us through the summary of the proceedings today. May we have Dr. Sanjay Bhavnani sir here?
So, well, good evening, ladies and gentlemen. It's been a long day, it's been a long afternoon, and we are progressing quite late into the evening. 21:17 is the time which is on my watch. And probably this is the only conclave which is extended till so late. I mean, to the best of my memory, I cannot really remember any other one which is extended to this kind of an hour. And that is also because we have been constrained by time. I don't know if you would not have been constrained by time, how much more, it could have been. But I think what's important is we need to all get together and offer our overall congratulations to the Marics team, which is very ably led by Captain Kamal Chadda. For bringing out this particular contemporary area of discussion. I think this is, since this is the first one on the subject, and the kind of discussions which have been held really indicate the need for having these kind of discussions that much more. I'm sure as time is going to go by, we will be having more and more of such discussions, and hopefully we'll be able to find much more effective and much more applicable answers. Anyway, let me just do the job at hand because we are getting late, and then I will start getting all kinds of gestures and all kinds of movements from the audience. So lest that happens. So I have been assigned to just give a summary. It's something which is very difficult to do because there have been speakers of a very high caliber in terms of their expertise, experience, and the overall perspective. But nevertheless, I'll do my best to be able to do that. The inaugural session was kicked off by Captain Girish Fadnis, who as the chairperson of the advisory board set the pace for this excellent conclave, leading to some of the very unique and specific perspectives being shared with the audience. I think under his entire chairmanship, the whole idea was very well conceived and also equally very well implemented, and that's how we are here till so late today. After that, we had a brief talk by Dr. Ilona, who is a former president of the International Maritime Health Association, gave a very good insight into the very important contribution and the very important role which has been played by the IMHA, especially during the COVID-19 pandemic. She highlighted the UN SDGs, number 3, number 4, and number 8. And underlining the main mission statements and objectives of the organization. She specifically highlighted Captain Dr. V.Z. Belani in playing a very important role and in making this organization that much more popular. And she talked about having possible road shows in Bombay and also in Delhi subsequently. And I'm sure as we go along, we'll see more of Dr. Belani. Of course, we have been saying him since the last so many years. But we really look forward to seeing you that much more. And of course, we look forward to seeing all the others as well. After that, we had a short talk by Captain Wenzi Vegas, who was the next one to take the stage. And in his usual articulate and dynamic manner, highlighted that on-board fatalities and support is related to the personal issues which need to be emphasized on. He highlighted the need for having more doctors all over the country, especially having some with the various government hospitals. And he also established the fact that there should be nurses, and he highlighted the importance to do so. And he also mentioned that these doctors should function under the overarching guidance of the existing doctors who are there already as far as the medical treatment and testing of the seafarers is concerned, to be able to build up their overall perspective. Next, we had a talk by our Honorable DG of Shipping, Mr. Shyam Jagannathan, who focused on the aspect of the human element, which continues to be one of the most important areas and the subjects of the entire shipping industry. And he said that this topic has become that much more important, and he highlighted the overall casualty data and the fact that prevention is better than landing up in a situation where you have to deal with it without really being able to do something about it. He also spoke about the PEME, giving importance to the fitness for purpose of the seafarers who are going to be joining the vessel, and also highlighted and shared with us that the overall aspect of the technology which is presently there to be leveraged upon is actively being considered at the directorate, and this is now going to be finding a much more effective way of being able to reach the industry, so that the overall physical and the other mental health of the seafarers can be better known and understood. He of course highlighted about the mental well-being, which of course set the tone for all the other discussions which we had during the entire conclave, and of course, at least me, I ended up getting mentally stressed after that, but hopefully that will go away. Then we had a very brilliant talk by Captain Amol Deshmukh. He spoke about a large percentage of the claims related to injury and the illness. He also spoke about the fact that the enhanced medical examination can end up saving a lot of claims. So having good level of listing of the enhanced test over and above the normal PEME test can be very, very effective as far as carrying out a much better business is concerned. He highlighted 21% increase between 21 and 22, 1.6 million to 2 million, and 40% of cost incurred, and all the other important statistics he shared with us. If we are able to get hold of those slides, it will be very helpful for us, sir. And I'm sure the industry will be able to look at that and be able to benefit from that very immensely. He of course, he highlighted that the happiness data has decreased over the last 2 years, and it is highest on the cruise lines and the lowest on the containers. And the engineers and the catering department are very high as far as the happiness index is concerned. So which is of course something which is good, but at the same time it also tells us where we need to do the balance amount of work. The people not belonging to this department also need to be focused on, so that their overall happiness index can also be increased. Then we had the first panel discussion, which was under the title of Concerns over PEME Standards Faced by the Medical and the Manning Sectors. I think one very important thing which was highlighted was the fact that there has to be a robust and a conclusive PEME, which is to mitigate. Basically the idea of PEME, as highlighted by the very brilliant moderator, Captain Halbe, was that to mitigate the risk of sending a seafarer not medically quite fit on board a vessel, to indemnify or to try and mitigate and minimize the risk which is to be shouldered by the ship owner while he is trying to keep the ships running very smoothly. His panel consisted of the various panelists. I'll just give out a very quick listing of all of them. First of them was Dr. Barfiwala, who spoke about enhanced PEME, highlighting the various rules and the changes which have been made, thereby resulting in certain conflicting statements and implied guidelines which don't really make the job very easy. He highlighted and he said that it's very important to have the guidelines which are very, very specific, so that there should not be any room for any kind of interpretation. What was expressed by Dr. Ramesh Nair, the second panelist. He highlighted the issues as being intertwined with the various human and the individual elements related to much larger interests. So decision making becomes that much more difficult. It's not something which is very specific, either black or white. It's basically varying shades of grey, and it has to be weighed within that particular context and examined and seen and established thereby whether that particular seafarer is fit to join or is not fit to join. Then we had Captain Basim. We all know him very well, and of course he was once again very vocal, very clear about his entire perspectives. He outlined the perspective of a typical seafarer, and he cannot emphasize this more, that the shipping company needs to complement a robust payment with an on-board welfare measures, which is very important for the overall health of the seafarer while he stays on board. Just having a PEME is probably just one step, but then he spends so many months on board. So the seafarer needs to be supported, seafarer needs to be given an environment, seafarer needs to be put into a situation where he can ask for help, where he can identify that he needs help, and he has a particular mechanism to be able to ask for help and be able to get it without any kind of a reprimand. So that was something which was very significant. Then we had Dr. Bilani, who spoke about and highlighted the fact of seafarers medical versus corporate medical versus a medical of a regular patient. He emphasized the need to have an honest self-declaration. And he also emphasized the fact that there should be unified payment as far as various guidelines are concerned. And he also said there has to be a direct proportion between quality and cost. If we are trying to reduce the risk, if we are trying to make the risk zero, the cost of that is going to be very high. And of course, he suggested recommendations, he gave that. And he also spoke about additional tests which are recommended for Indians as a nationality, as a race. So probably that should be considered by the directorate, and I'm sure our very capable body of the medical professionals which we have in this country will be able to come up with something which will be very useful, and will try and make the Indian seafarers that much more medically fit as far as the international ship operators are concerned, thereby not only increasing their jobs, but probably also being used as a certain kind of a benchmark, not in the very distant future. Captain Nitin Mukesh, as a representative of the directorate, he was of the opinion that all guidelines which have been given by IMO, ILO and all the other bodies are very clear. There is nothing much to discuss on that. And the fact that the doctors have to make a professional judgment after having examined that particular seafarer and really establish whether he is fit to go out to sea or not. The reports need to be standardized to ensure harmonization of the various outcomes. He gave us the insight that there are 1,023 doctors who are registered in India, and they have a full set of these rules. And of course, he did share with us that they are being revised and they are going to be announced soon, and all the various stakeholders will be invited for having a discussion so that they can become that much more effective and that much more useful in the times to come. To say the very least, this entire panel discussion was brilliantly monitored by the ever-eloquent Captain Balve, who picked up the finer details of the declarations as well as the other intricacies of the entire PEME process. The seafarers, he asked the question, will the seafarers provide the detail correctly and completely? And he asked this question to the entire panel. To be very honest, I could not fully catch the answer. Later on, we'll ask Captain Balve what the outcome was. But definitely this was a question which he posed, which was very important. But yes, I think it's a very valid question and something which we need to really understand and see what we can do to improve our own levels of effectiveness. He also suggested that probably the administration can obtain the data from the various international P&I clubs and see how they can be correlated to make the entire guidelines that much more effective. The areas which are probably having a greater level of attention can be included in the guidelines that much more significantly, so that we are able to learn from what has happened in the past and do our best to make sure that they don't really happen again. Then we had a brilliant presentation by Mr. Avjot Kumar, who stressed on having a very good dialogue with the patient, besides of course treating him medically as well as in all other respects. He said a major part of course he referred to about 50%, but I would probably extend it to a major part of the entire dealing, and a major part of the entire treating the patient lies in being able to communicate with him, being able to give him the required confidence, and making him feel that he has come into the right hands and he can look forward to his condition being addressed henceforth. And he, of course, highlighted the importance of assessing and providing the rationale of being fit and unfit to the various seafarers. If a seafarer is found to be unfit, then the seafarer should be told as to why he is unfit and what is it that he needs to do about it. Something which is very, very elementary, but something which we probably tend to not really give the required attention to, because after all, if a seafarer is being tested, assessed medically, it is for his own good. And it's very important that we are able to share this with him honestly, and we are able to share this with him reasonably sincerely, and expect him to really understand that all this is being done for his good more than anything else. In a very common sense parlance, this reinforces the fact that the seafarer should be made to understand the importance of looking after his own health, should be made more accountable and responsible henceforth. He outlined his experience of dealing with the various medical conditions of the seafarers on board as far as both physical and mental conditions are concerned. He suggested a clear path for the seafarers to follow certain preventive mechanisms, thereby widening the scope of the entire telemedicine aspect in a very adequate manner. He summed up by highlighting that telemedicine as a practice can be effectively carried out efficiently and effectively while using the welfare of the seafarers on board. We had another very good speaker. We all know her very well. That's Dr. Deepti Mankad. She commenced with highlighting the importance of mental health as much as physical health, if not more. Gave an insight into the study undertaken on mental health awareness. She outlined the various purpose and the objectives of the study, and she was very kind enough to share with us the results of the study, which basically highlighted the fact that a good level of awareness of mental health was very, very low, both across the sailing staff, across the shore staff, across the officers, across the ratings. So I think almost the entire cross-section of the industry needs to improve on their awareness and understanding of the mental health. Same was also applicable for the various pre-sea cadets and the trainees, and she highlighted how she is partnering with the industry to improve this condition, which can only be done over a certain period of time. She summed up by highlighting the fact that after increasing the awareness, there has to be an intervention, and there have to be policies and procedures to be set up by the companies, the importance of which cannot really be overemphasized. All this simply made us realize once again as to why she is considered to be an industry pioneer when it comes to dealing with the mind and its various issues. So this is probably very close to you're looking for a word for mental health. So the mind and the issues could be one of them. I'm sure there could be very many, but it's something which I was just able to think on the spot. So, but yes, I think that's something we all know her to be an industry pioneer. And I'm sure as we go along, we'll see more and more achievements from her. And we really look forward to, hearing more about this particular subject, which will do a lot of good to our entire industry. So thank you very much, ma'am. Then we have the second panel, which was again very, very effectively moderated by Captain Mike. He straightway came to the point and asked pertinent questions to each of the panelists. The first panelist was Ms. Divya Nair. She gave an insight as to how assessments can be carried out and the importance of integrating them proportionately within the entire context. She highlighted the significance of trauma and the importance of dealing with this on board, and also the very significant contribution to be made by the onshore and the on-board leadership to deal with this effectively. Dr. Videsh was the next one who gave an insight to deal with the possible mental health issues, including anxiety and depression. Reassurance after the same requires acceptance, requires to be accompanied by some medication on board, and which has to be administered as a potential way forward. He also established the correlation between an increase in the mental health issues on shore with those happening on board. So what we really see on board is really an indication of what is happening in the entire population. So not really very surprising, although later on we got some other insight from very industry senior. But yes, mental health issue is something which we all need to take very seriously and try and do whatever we can about it. Then of course, we had very brilliant inputs that was provided by Captain Rajesh Tandon as far as bullying and harassment is concerned. He highlighted the fact that these cases may be fairly complex to deal with, unlike what they really appear to be. Bullying and harassment is something which we all think is very simple, but no, I mean it can be much more complex than that. Trying to take a person to task doesn't really necessarily amount to harassment, because that's probably at many a times the only way to be able to set him on the right path, which maybe he doesn't understand at that point of time. But then if you are going to spare the child, then there's a problem in that. Then you end up spoiling the child. Spare the rod. Sorry, I'm not as senior as you are, so I'm sure I can be excused for that. So to say the very least, harassment may be misunderstood as an expression of relatively limited mental resilience. I think this was a point which you made, sir, which is very, very important. As you mentioned about what you learned from your seniors and what you have taught to your juniors. I think more than anything else, it has helped build up the entire mental resilience. And of course, whatever physical skills and all other technical skills have been passed on is something which has also really helped them in very, very good stead. And it was very masterfully dealt with, and showing us why he was referred to as the senior most member of the panel, quite justifiably and appropriately. Thank you very much, sir. Captain Anshul Rajvanshi highlighted the case of a delayed sign-off resulting in a suicide of a very young officer on board. Something which was very, very tragic, very extremely unfortunate. And I know, just hearing about it also makes you really feel that, well, why this really had to happen? Was it necessary? And he, of course, highlighted that it is very important that these signs should be picked up at the earliest, because any kind of a delay could result in a consequence which cannot really be undone. In this case, unfortunately, it could not be detected at all, and thereby it could not be avoided. He highlighted that the seafarer should be encouraged to say that it is to understand that it is okay to be not okay. Absolutely. I mean, if you're not okay, please ask for help. Nothing really wrong with that. And of course, this is somewhere we all need to be able to lead the way and be able to teach all the seafarers and be able to convey this message to all of them, both on board as well as those who are on shore, to make them understand that this is something which is very, very critical. He highlighted, he called the industry to take collective action to prevent such cases. That was one of the moot points which he highlighted. The need to recognize signs of mental health early on is something which is very, very important, especially on board, which can really become very critical in trying to avoid these cases from happening again. We had a very important perspective which was shared by Dr. Matthew. He highlighted the importance of carrying out various tests to establish the overall psychological fitness. He highlighted that the mental illness cases are on the rise amongst the entire population, and it is no surprise that the same is also detected to a relatively greater extent amongst the entire seafaring community. He once again stressed on the various conventions and guidelines being very, very clear. So that is something that's a very important input. The guidelines are very, very clear. It is just the interpretation which probably can vary, but then at the same time, if the interpretation is done in a manner in which it should be, there should not really be any ground for confusion or any kind of an implied subjectivity. Then we had Ms. Sonal, who told us about the various calories which are there in the food, ITC dinner. So something which is really going to make us think, but then at the same time, I am sure once in a while it is all right. She stated by identifying the elephant in the room and also said that obesity and diabetes and other lifestyle related conditions need to be given the required importance and the required kind of recognition. And she stated that how important it is to deal with this through effective counseling. Typically, seafarers during the leap period are prone to be guilty or succumbing to all these temptations and hence need to take more care by a possible nutritional intervention. Training given to chief cooks and other personnel can be helpful was another point which was raised by her, which of course probably can be done, probably cannot be done, but yes, it's definitely a point which should be considered, and I'm sure whatever is going to be done about it is going to be helpful. We would like to, I would like, and I'm sure all others would join me, we would like to congratulate Captain Knight for ending this excellently moderated discussion, for conducting this excellently moderated discussion and ending it within the required time frame, which extended quite late in the evening, but still ended up generating a lot of interest, involvement and possibly passion. So thank you very much, Captain Knight. I think that's it. I've come to the end of my notes. I have nothing more to say. So I think that's it. So I hope I have not missed out anything. I hope I have not stated anything which is incorrect. If I have, my sincere apologies. And at the same time, I have done my very best to make this happen. Thank you very much.
I request Captain Chadda to present a token of appreciation to Dr. Bhavnani. That was a very detailed proceedings and we are very thankful to you. I request Captain Kamal to propose a vote of thanks, please.
Thank you. Before I do the vote of thanks, I have something to tell you all. Sonia Parmar, please come up on stage. Thank you. Barracks has been in existence this year for 25 long years, and out of those 25, Sonia Parmar here has been with us for 24 of them. I have a brilliant team. They have been very, very good to me. They have supported me in every which way, done a wonderful job for all these years. But Sonia is special because she has really hung in there all these years. When she came to work for us, she was 21, something like that. Yeah. I'm telling you that because that's an interesting aspect. She comes. She says she is 22, so very sincere. Okay, and but the thing is, she joined us, she got married while she was working with us, she had two girls, two daughters when she was working, and now, only last year, her older daughter went to Canada to study. That's her 24 years with us. And one more interesting fact I must tell you about her. She was born in a Hindu family. She was adopted by her neighbors who were Muslim. And then she came to work for us and fell in love with a Catholic guy. And married him. So that's Sonia. Please give her a big hand. And now for the least interesting part of the whole evening is the vote of thanks. So quickly on behalf of Maritime Media, I extend my heartfelt gratitude to each and every one of you for being a part of the India Maritime Medical Conclave and Awards. This event couldn't have been possible without the collective efforts. I'm going very fast now. And because the dinner is waiting, and so is the whiskey, and it's been such an exciting day. I need some whiskey to calm me now. The mental health, my mental health is worrisome now. And today we take a moment to express our sincere thanks. We are honored to have had Chief Guest Shri Shyam Jagannathan, DG Shipping with us. His presence added great value, but he's not with us at this moment. We'll convey his thanks to him later. We have had our guest of honor, Dr. Ilona Denisenko. Ilona, please arise so we can all give you a big hand. She's here all the way from Moscow, and that great effort she's made to come here and be with us. I really appreciate that. Is Captain Vinci Vegas here? No, he's not. He knew what to do. Now, I'd request all the speakers, all the panelists and the moderators to please rise. Please, speakers, panelists and moderators, please give them a big hand. Thank you so much for doing a brilliant job. Thank you. And now, I request all the medical professionals to please rise. All the medical professionals in the hall. Let me see how many are there. Wow, that's a big number. Brilliant. We're not going to ask you for credentials. Anybody feel like standing up, please? No, hang on. Please stand again. We can give you a big enough hand. I'd like to acknowledge the support of various associations that have endorsed and partnered with us. Your collaboration has been pivotal in creating a platform for knowledge exchange and networking. A sincere thank you to our sponsors. Your financial support has been instrumental in making this conclave a reality, and the dinner and the drinks are on the sponsors. My heartfelt thanks to my team, which has put this entire event together in less than a month. They have really worked hard, contributed immensely in making Maritime Media to its silver jubilee year. I couldn't thank them enough. Thank you, my colleagues. My gratefulness to members of the media, the great cooks and staff of this hotel. After all, happiness starts and ends with our palates and our stomachs. Please enjoy the rest of the